So for my capstone, I decided to create a occupational therapy developmental screener and a guide for early childhood education. I did my capstone with St. Thomas Montessori, and I worked in collaboration with Hillary at Social Pediatric Therapy, who was an occupational therapist. And the age groups that I worked with were a toddler classroom and a primary classroom of the ages 18 months to 6 years old. And I screened 16 children throughout the process with the screener that I created. And then within the screener, which will be passed around in a minute, that kind of just encompasses a bunch of different age ranges that I was able to screen and incorporate educationally appropriate milestones as well as some daily occupations like dressing that they may need to do within the Montessori. I noticed when I was there, a lot of kids did have like slippers because they wouldn't allow them to wear their outside shoes inside. So I noticed a kind of lag on being able to put their outside shoes on when they were taking their slippers off because the slippers were just so easy to slide on rather than actually having to tie a shoe or even just pull it through. So that was definitely a gap in what I saw when I was there. And then within the developmental milestones guide, I included for parents and educators to have what you might see at that age and then how you can help, and then also when to consider OT and then when to like kind of refer out, and then what to expect next. So I like the fact that I created the guide to include all of the ages so that a parent and an educator could kind of have it through their child's lifespan, which would be from 18 months to 6 years old, so that lifespan. But they could look at it and kind of just know whenever they're transitioning to preschool or to kindergarten what they need to look for and when they should maybe seek services for occupational therapy. And I decided to do this because as I was doing my literature review and my last research project, I noticed that there was a gap in developmental milestone screeners for the Montessori setting, and specifically from an occupational therapy perspective, because a lot of the screeners that exist are from like a pediatrician or a doctor creating it that doesn't really have that functional OT lens. So they might miss some of the milestones that fall through the cracks that might show up later on in kindergarten or in elementary school. And I noticed throughout this project that early identification can lead to greater long-term outcomes. And even just working with some of the kids that one day that I was there screening, I noticed delays and I was able to pass that information on to Hillary, the occupational therapist, who works at Social Pediatric Therapy, to kind of reach out to those families to kind of get some early referrals going for occupational therapy services. I also left the screener with the Montessori so that they could use it there when I'm gone, because it is made for an educator or an occupational therapist or really anybody to be able to administer, since it is not standardized. And it provides the educators with clear information on how to address the delays. So within the screener packet, I have all of the tools that you might need to use. I have all of the different age ranges and what you need to see happen to know if they met the milestone, if they're emerging, or if they don't have it, and then also an area for comments. So this capstone helped identify functional skills that the Montessori didn't know existed that the children should have at the age ranges that I screened. I had some of the educators tell me that they didn't even know that a child should be able to catch a ball at 4 years old or do things like that because they're so focused on very structured tasks where it kind of doesn't allow the kids to branch out and learn those gross motor milestones where they're more so learning fine motor or sensory, but gross motor is also a big aspect in a child's development too, which they didn't know. And that kind of leads me to help bridge the gap between school and then therapy services. And it was even something they considered that further down the line one day, depending on how it all goes, they'd like to have an occupational therapist in the Montessori because they once had a speech therapist there. So they felt that that would be beneficial to the students and the educators. And then it also provided education on I provided education on how to carry this over in the classroom. And a lot of the educators already told me that they were able to use some of the activities that I implemented into the screener in their classroom as like whole big group activities to kind of address it and not just single one kid out and address it with one kid, but kind of to reiterate that movement or that skill to further push it into their brains, I guess you could say. And then the whole point of my capstone was to advocate for OT in that setting and for early intervention and just for further referrals. And my big call to action, I'd say here, is if we see it early, we can support it early, because that can change a whole child's trajectory. Missing one milestone that might just be catching a ball could be something in 3rd or 4th or 5th grade that they notice, and it impacts their fine motor, their focus, and all of the other things that not many people think about. So that's all. Thank you. Thank you, Dr. Paul, and Hillary, if you're watching, thank you for supporting me through this process.
I'm the dad, so I got it. So how responsive were the parents to this activity that you performed?
So I wasn't really in communication with the parents, but I did have the lady that I nanny for, her kids were screened and go to this Montessori, and she told me that even some of the things that because I sent the packets home, the results to the parents, so they were in communication with the teachers, but not me, unfortunately. But the lady I babysit for did tell me how she started implementing some of the handouts, the scissor cutting, because I told her how the girls might need to work on some of that a little bit more. So I would say
they'd be able to take that home to the parents, like as they learn through the program, the parents can then take
yes.
over.
So I forgot to mention, I did send that guide home to the, I sent it to the Montessori educator, and she emailed it to all of the parents so they could have that tool. So she kind of had that communication with the parents. And then they also got their child's results after I screened them.
Yeah. Is there anything now that it's...
Oh, I didn't see you. Go ahead. I couldn't see you through that. Yes, go ahead.
Is there anything that you would change, add, or take away from your screener now that it's finished and you've actually used it?
I feel like more so formatting wise, I'd probably just make it look a little different. But I feel like as for the content, maybe like practicing it before when I actually, because the first time I did it was with the first student that I did it with. So some of the things weren't as appropriate for the Montessori, like one of them was washing hands, and I wasn't able to see that with some of the kids because there wasn't a sink in the room that I was able to use at the school. So maybe just thinking further, and next time check in maybe with the environment that I'll be presenting the screener in to make sure that they have the tools that I need to see that milestone be accomplished.
So it'll be like adaptable to the environment.
Yeah.
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 Yes.
One more question. Do you have plans to publish this or disseminate it more widely across other Montessori schools?
So I was thinking about that because the at social pediatric therapy, the speech therapist would go to different Montessoris and not just St. Thomas Montessori. So I was definitely thinking about being in further communication with them and kind of getting some more connections to those Montessoris, and hopefully further down the line, getting it in other places so they could use it.
It sounds like one teeny tiny piece of Oakland County, Michigan is going to have really prepared kindergartners.
Yes.
Yay. Thank you.